So one of the primary concerns is the healthcare question is how can we make our healthcare costs sustainable? And there was a good question asked during the leadership debate where the moderator said all the leaders are promising a yearly increase in the health transfer, but how are they going to afford it? And I think we need to look at ways of cutting costs in our healthcare. But of course, cutting doctors, nurses, and hospital is not an option. So where do we cut? What do we do? There's an area that has been putting an unfair burden on our healthcare, and that is the skyrocketing drug costs. So workplace is also suffering due to the increasing drug costs, like workplace benefit. So we need a national strategy to drive the drug costs down. And data from 2008-2009 shows on national level, like the drug costs account for 16.4% of spending on our healthcare. So that makes up a huge chunk of our healthcare costs. So the annual rate of increase between 1985 and 2007 is 6.6%. And what causes the high drug prices? One culprit is the patent laws and abuses. In 1987, the government decided to introduce Bill C-22, which extended the patent term to 10 years. And the government also established the Patent Medicine Prices Review Board, PMRB, to fix the prices for the brand name drugs. So in 1996, the government further extended that patent term to 20 years. So the justification by the government officials and the lobbyists for the pharmaceutical companies was that this would encourage research and development. So they promised to invest 10% of their sales towards research and innovation. And in 2006, our current government gave the drug companies a data exclusivity of 8 years. So apparently, our patent approval process takes a long time. And data exclusivity provides the drug companies extended protections and allow them to keep out competition for 8 years after drugs were approved. This is supposed to make up for the time period that they need to test their products. But NAFTA only calls for a data exclusivity of, it says, no less than 5 years. So I'm not sure why the government decided to give them more than required under the treaty. So data exclusivity is better than patent for the brand name companies because no application is necessary. This is automatic. After approval, they get 8 years. And nobody can manufacture similar drugs. And since competition are kept up with much longer, Canadians end up paying more for drugs. And the supposed benefit is more money will go to research and development. But is that happening though? Like the PMRB annual report as of 2009 shows R&D to sales ratio decreased to 7.5% in 2009 from 8.1% in 2008. So this has been consistently below the 10% that they promised back then for us having to have this extended patent and pay more for the drugs. And so, like also the basic research is only 2% of the sales revenue. So I guess this would have been an indicator whether they're putting basic research, finding new cures, new drugs, but it's not. But they're still applying for patent, and where does this come from? And that's where the abuses are, where the drug company resort to a practice called evergreen. And they would just change the shape of the pill and then apply for a patent extension. And so this is essentially keeping out competition for a longer time. So even without the evergreen practice, they also use slight modification to the ingredient, to the content of the drugs that have nothing to do with the therapeutic effect. And so there's no improvement in cure, but then they use that to claim another patent extension. And generic drug prices in Canada is also higher than other countries. The generic drug companies also face increased costs from litigation, so that could be a factor. And this is a tactic used by the drug brand name companies to, after the patent has expired, to sue the generic companies so that they cannot manufacture the drugs until the litigation is over. So this gives an artificial extension to their patent term. And how are we going to solve this problem? This is actually in line with what our party is proposing with regards to patent reform. So we reform our patent laws and reduce the patent term. And also, I guess we should also speed up our patent approval process as much as possible, and also clarify the law to avoid the litigation being used and excused as a tactic for prolonging the patent term. And I think we need a better coordination between the federal and provincial level. Right now, the federal government set the prices through PMRB, but provinces shoulder the cost. So federal needs to be more involved to fully appreciate the burden drug costs is imposing on our healthcare, and start implementing national pharmacare program to control drug costs, and also replace as the PMRB. Huge savings can be expected, like in billions of dollars. And there's already an accord signed between federal and provincial level for the national pharmacare program. But there seems to be a lack of political will to pursue this at the federal level. So, and as proposed by our party, savings from our having lower drug costs due to patent reform can then be redirected to publicly fund research, like publicly funded research into new drugs. And with drug companies' basic research only at 2% of their sales, having a parallel research backed by a public funding would provide savings in the long term for the public, and the findings from that research, of course, will be made publicly available, and drug costs will be low, can be expected to be low. So private donor can also contribute to the publicly funded research, just as people already buy lottery to support cancer research, for example. And I believe this strategy will help drive our healthcare costs down, making it more sustainable